So this is a whiteboard drawing of something I did with a patient who is struggling to get better. I'll give you a brief background, but this can apply to a lot of different patients. I didn't record it while I was discussing it with her, but I thought I would take a picture and review it now. So basically this patient, she's had a lot of issues. I've never actually had much success with her. She canceled her appointments. She was in pain for a couple weeks after last time. I said, "Why don't you come in? We'll talk about options." I worked with her a little bit today, and then I said, okay, let's talk about options. And I wrote options 1, 2, and 3 in part A and part B. And then with her, I wrote the different options. I said, no, I want to make sure we go over all the options. I'm not going to say which one I recommend right now. Um, and so option 1 was conservative care, exercise, what we've been doing. Option 2 is a surgery. And so she wouldn't know, we don't actually know what surgery. She had an MRI. It said some of the signal wasn't great, which she was concerned about, but there wasn't anything major found on that MRI. But I'm sure we could find something that a surgeon would be willing to cut on. Or the option 3 was nothing, where she just keeps going, as she is, and she doesn't worry about it. And so I explained to her, conservative is this, surgery, have to wait and see what was recommended. Even then, I don't know if it's a good idea. And she was like, yeah, I've had 9 surgeries in the last like 6 years. Um, she's not itching to have a surgery. Option 3 is nothing. I said, there's a benefit sometimes just not to worry about it. Just go live your life and not have to think, oh, I'm going to have to tell this person, come back and tell me how I've been doing, and just, try to go on. I said in option 1, we have 2 parts. One is part A, local specific progressive exercise. And this is the tendon issue she's dealing with, but whatever it is, we need to target. And hers seems to be pretty nociceptive. There's definitely some psychological and social aspects to it, but it's localized, and she has very much some nociceptive pain, a significant amount. And I said, it's going to be painful. It's not going to be easy. I wish I could just pop your neck and we'd walk out of here high-fiving each other. If that was the case, I would have done it yesterday. And it's going to be a difficult process, but it's targeted there. And we're going to have to measure it. And then I said part B is cardiovascular exercise. I said there's evidence to show even people with shoulder pain, if they can get cardiovascular exercise using their legs, it can help their shoulder pain. Now, is that all that the shoulder needs? Obviously not. But that is a piece of it that can also help. We discussed it's challenging for her because of other um, pains that she's having elsewhere, but we decided maybe a bike that she could use, and there's some challenges with that, but we can work through that. And then she also said, a lot of people think, looking at me, I may not eat very well, and I'm not active. It's like, I'm very active. I may not exercise specifically, but I do a lot. And so I went over activity and exercise. Activity is random but productive. Exercise is measurable and progressive. Said, with her activity, it's difficult to know, how much we've done and is it different the next time. She said, well, some of it is. And I agree with her. And I said that activity can dictate a little bit of the exercise, but it can't eliminate it. So again, it can dictate the exercise but not eliminate it. What that means, a manual laborer working all day, hard labor, doesn't need to do as much exercise as maybe somebody who's sitting in an office chair all day. But they probably need something specific, something progressive, something that they can measure. I said, so we may need to get a little bit targeted at that shoulder so we can see, is it changing each week? Are we making any progress? And also the intensity so we can get it up higher with the cardiovascular exercise as well. That there is a known benefit to that. So that's what I went over. This is a good way to go over with somebody who's not making progress. They need to know that there's more than just what you can provide, and that doing nothing is a possibility. Otherwise, they'll leave, what else is there? She's already had a cortisone shot. Otherwise, I could have put that up there, but we probably don't want to just keep having going cortisone shots. So she did ask me about that afterwards. There may be different options depending on what the condition is, but oftentimes there's something you're doing, a surgery or nothing, or maybe a combination. I could have just given her an exercise and said, sayonara, keep going with this. She chose to do option 1. She said, if I ever am in pain for another 2 weeks, though, I'm going to not come anymore. And I get that. I got to make sure we're on the same page. So I recognize with her how active she is. that this is tough and it's not going to be easy. But if she chooses to do that, and here she chose to do that, so I know that I can bump it up a little bit each time, and she's not looking just to go away and do nothing. Because before this, I said, "What are your other options?" When she was considering canceling the rest, she said, "Well, I don't know. I don't have, there's no plan." And so this way I could lay it out for her, and she chose option one. Sometimes people will choose option two or three, and we have to be all right with that, as long as it's a shared decision-making process. They know our opinion, they know somewhat what the research says, they know how to consider it, but we value what they're telling us. And that's where these options played into role. Conservative surgery, nothing, and then what would go into the conservative care.